for those that opt out of the surgery, what's the worst thing that could happen in the long run?
So traditionally, the worst thing that will happen in the long run is where we see the bump up here. Traditionally, in a bunion deformity, the big toe goes towards the second toe. The reason that that gets important is you end up with malalignment of what we call the first metatarsal phalangeal joint, or the first MPJ. That's the joint at the base of the big toe. Traditionally, a patient's going to end up with pretty moderate to severe arthritis in that area. And if it goes neglected long enough, the big toe starts to impinge on the second toe, and then that can cause the second toe to elevate, and then they have what's called a crossover toe, where most patients come in, well, I don't want my foot to look like my grandma's foot, where it was kind of like crisscrossed. That's a neglected, untreated bunion deformity that's progressed to moderate to severe. When the patient gets that far along, our surgical options decrease because arthritis has spread into other joints. There's ligament damage and toe dislocation. And so the more work that the surgeon has to do in a specific area, the increase the risk, the longer the healing, the more chance of recurrence. And so the surgery just gets more complicated and the risk to the patient goes up. And so, I don't ever try to force surgery on any patient. It's, their decision and their right to make that decision. But we want to educate them to know, hey, you have this problem now. Well, it can get worse in 3, 5, and 10 years, and this is what it would look like. And so it's important for patients to understand that because say you were 50 years old, well, I'd rather do surgery on a 50-year-old than a 60-year-old. Their capacity to heal is going to decrease with time. And so it's always better to fix the small problem the right way when it's easy, as opposed to a bigger problem when it's harder. Bunion surgery is highly successful when picking the right patient and picking the right procedure. And so it's just important to educate them and let them know their options. That way they make the best decision for themselves.